Good morning, Anki Spondy people. Today we are talking about the community pharmacist, and I have with me my pharmacist, Dale, from Millcroft Pharmacy, and we are in Burlington, Ontario. I know there's people that watch from all over the place. One of the things I thought I'd mention is that a lot of people in the US, because I'm originally from there, a lot of my relatives don't understand that in Canada we actually don't have free medications. There is some free medication when you're over 65 or under 25, but people in my age group, we have to go about other ways of getting our medicine, whether it's through insurance and other things that we'll talk about with Dale. So the first thing that I wanted to just say is that it's really important, I find, is to have I like the community pharmacist. And the reason I like that is because you have a relationship with them that's really important, just like your physician. In some ways, even more important because you actually spend more time with them. And just so everyone knows, we've discussed that I'm in pharmaceutical sales, so I do a lot of work with pharmacists. But Dale is not in my sales territory, so I'm not here with Dale because I get any benefit from it. It's just because she is my pharmacist. I moved recently, and I had to try to find a new pharmacy. And I did a lot of, went to a lot of pharmacies I didn't walk there. I went to a lot of pharmacies trying to find someone I liked. And one of the things that really drew me to Dale was the fact that she was very personable when I came in, really wanted to spend time with me, talked about all the things that she does for her patients, and just made me feel very at home. And I think that's something that's gonna be really important. So there's a lot of things when I come in, I'm always honest with Dale about how I'm doing with my medicines. She always gives me tips. But the community pharmacist is very different. You go into a big box store, and if that's what you choose, that's your choice. But for me, it didn't feel as personal, even before I had a pharmacy inside a grocery store, and I loved one of the pharmacists a lot. But the other three, it was like so-so. So the days when that pharmacist wasn't there, I didn't feel as comfortable, and sometimes I'd actually skip going. I just decided to come back another day. So what's nice about the community pharmacy is you always have one, and if it's a bigger store, you might have two people that you always have, and it's very consistent. So that's what I really like.
That's really important.
So
that's one of the fundamental things about a relationship between your patient and your pharmacist. Yeah.
So what do you find with the community pharmacists? What sets them apart from the big box?
Well, for me, I've worked in both, but I always gravitate back to the smaller independent, just because you know your patients by their name, you know a lot about them. And I grew up with a community pharmacist like that, and that's what drew me into pharmacy. Is he knew so much about our family, he treated us so personably, and I think that's the relationship that we want to have. And unfortunately, you don't really get that with the bigger box stores unless you try to cultivate that. And that's not to put down the box stores by any means, but because it's part of my family. My patients, when they walk in, they join my family, and I treat them like family. So that's how it works. I have a call coming in, but that's okay.
We can always interrupt. So the other thing I wanted to ask was, I know that when people have medications that are expensive, some of the ones, I'm on a lot of different things.
Yes.
And I know that you work with some of the patient support programs.
Yes.
And you also have, what are they called?
We have these, they're called patient assist programs. They're to help promote the use of brand name products, whereas a lot of insurance plans, especially here in Canada, they pay for the generics, which are the lowest priced products. Not to say that they're not good, but patients often want to pick the brand that they wish, and it's not fair that they don't have these options if they have a third-party insurer. So these patient assist cards basically promote the use of brand name product, so that you can select the product that you wish, and they pick up the difference between what your generic company would have picked up, your insurance, versus the actual brand price, because it can be considerably different. There's a huge difference sometimes in price. And then, so we facilitate that. I'm sort of the liaison between the specialty programs, so that the patient doesn't really have to do too much work. We've already done a lot of work to get into these programs, and it's my job to take over and make it very seamless for you, so that you don't have to worry about anything. That's why we're here.
So is that something a patient, because I've noticed other pharmacies I've been at, they don't offer that. So is that something that, do you not make much money?
No, it's not even that. I think it's a comfort zone for a lot of pharmacists. They're maybe not understanding these programs as well as they should. They may not have the personalities that want to delve deeper into these products because there's a lot of talk, a lot of discussion. You have to be very, comfortable with the disease state, your patient, and all of the other things. And some pharmacists, to be honest, maybe just don't have the time.
Right.
It's not fair to them either, but if you're pumping out 500 prescriptions a day in a big store,
Yeah.
you do not have the time to speak to insurances or to delve into other issues. You're basically filling and going, and you're
Yeah,
trying to just
that's
keep
true.
up. So
Right.
that's
So it's
part of the problem too.
Well, which is why I make the choice to come here.
Exactly, because there's always time. There's always time.
Great, thank you. Well, this is the end of this series, and we'll be back in a few minutes with another one. Thank you.
Bye.